roads there at Alameda Genoa in a right lane. Also, North Loop at Irvington. Reports of a new accident. Seeing some delays there already. Watch for emergency crews rolling out.
Support comes from Specs Wines, Spirits, and Finer Foods. Texas family-owned and operated since 1962. Celebrating the holiday season with sparkling wines, champagnes, and bubbly beverages. Details at specsonline.com. The fun starts here.
Weather sponsored by Stewart PC, attorneys for executives.com. Mostly cloudy today. See the sun poke through every once in a while. Low 60s for the high. That's it. Upper 50s for the low tonight with a 40% chance of rain. That's going in to Wednesday as well with a 50% chance of some showers. Right now 49, Pearland 45 here at U of H. It's KUHF Houston News 88.7. The service of the University of Houston, 9 o'clock.
A new Medicare program in Texas will use AI to approve or deny certain services. I'm Michael Haggerty, filling in for Craig Cohen, and today on Houston Matters, what that could mean for Houston patients and what it signals about the future of healthcare.
Houston Matters with Craig Cohen is a production of Houston Public Media with support from Baylor College of Medicine.
Also this hour, can giving a citation to a member of Houston's homeless population keep them out on the street longer? We discuss the city of Houston's current approach to homelessness. Plus, we'll consider how Houstonians can keep the peace at home while navigating holiday traditions that might put an unfair burden on someone in the household. And we visit an immersive multimedia holiday experience at ARTECHOUSE Houston. Thanks for joining us on News 88.7, and remember to check out our live video feed on Houston Public Media's YouTube channel. We start, though, with a news update from NPR and News 88.7. Stay with us.
Live from NPR News in Washington, I'm Corva Coleman. Stocks opened mixed this morning as a delayed report from the Labor Department showed a jump in the unemployment rate. NPR's Scott Horsley reports the Dow Jones Industrial Average slipped nearly 70 points in early trading.
U.S. employers added just 64,000 jobs in November as the unemployment rate climbed to 4.6%. The economy recorded a net loss of jobs in October as tens of thousands of federal workers who took buyouts earlier in the year were officially dropped from government payrolls. Job tallies for both October and November were delayed by the 6-week government shutdown. Healthcare and construction saw job gains in November, while factories and delivery companies cut jobs. The softening job market means employers are not having to raise wages as fast as they were. Average wages in November were up 3.5% from a year ago. Scott Horsley, NPR News, Washington.
Authorities in Providence, Rhode Island have released new photographs of the suspect in last weekend's deadly mass shooting at Brown University. 2 people were killed and 9 others injured as they attended a study group. Rhode Island Attorney General Peter Nerona says authorities are asking for the public's help to find the suspect.
We don't know where specifically he is right now, but we can and have been able to trace his movements both before and after the shooting in the immediate vicinity of the Brown, Barris, and Holly building. And so, piecing that evidence together, we are making progress. And we expect as more tips are coming in and more, we're going to be able to push out, I think, some more video evidence.
He spoke to NPR's Morning Edition. Police in Los Angeles say that today they'll give their homicide case to prosecutors. This is over the killings of Hollywood director Rob Reiner and his wife, Michelle. L.A. police say they suspect the Reiner's 32-year-old son, Nick, is responsible. Nick Reiner is being held without bail. He has not been charged, and he has not made an initial court appearance. California's governor is hiring the former director of the Centers for Disease Control and Prevention, whom President Trump fired. NPR's Ping Huang reports this is to help create a new public health initiative with nationwide reach.
It's called the Public Health Network Innovation Exchange. California Governor Gavin Newsom says it's a direct response to the dismantling of federal public health systems.
We're not trying to replicate anything at scale. We're not naive about the size of the federal government. It's not a shadow CDC we're creating, but it's a shield to what's going on.
Newsom has hired Susan Menares, the CDC director that Trump fired in August, and Dr. Deb Howry, a former top CDC official, to lead the effort. It's meant to be a collaboration between states to better detect and respond to emerging health threats and to maintain trust in science-driven public health policy. It's currently funded for $4 million from California's budget. Ping Huang, NPR News.
On Wall Street, the Dow is now down 130 points. It's NPR.
Support for NPR comes from NPR stations. Other contributors include the Wallace Foundation, an independent, nonpartisan research foundation collaborating with grantees and partners in the arts, school leadership, and youth development. More at wallacefoundation.org. This is NPR.
Live from News 88.7 in Houston, I'm Matt Harab. New this morning, police have arrested a man who they believe blocked a Spring ISD school bus yesterday by pointing a gun at it. Authorities increased its presence throughout the district bus routes this morning as a result of that incident, which occurred off of Burnham Wood Boulevard, according to district officials. Police say the man stopped the bus, approached the door with the gun, and then fled the scene. Nobody was injured yesterday, and the kids got to school safely. The district says there are no active threats to any of its campuses. The City of Galveston's Tree Committee is asking residents to be aware of lethal bronzing in local palm trees. News 88.7's Juliana Washburn tells us more.
Lethal bronzing is an incurable disease in trees spread by bacteria that only infect plants and are transmitted by insects. Sudden fruit drop, browning leaves, spear leaf death, and root rot are all signs of the disease to look out for. Boone Holliday is the Texas A&M AgriLife Extension horticulture agent in Galveston County. He says they're working to quarantine areas with infected trees to help stop the spread.
Each time we find a new positive confirmation, it spread that quarantine zone out. So we're still in the early stages of this, so we just don't know how vast it's going to become at this point.
Holliday asks those who notice signs of lethal bronzing to contact the Galveston County AgriLife Extension office. From there, they can determine if the tree needs to get tested. From the Galveston County Bureau, I'm Juliana Washburn, News 88.7.
A Baytown police officer has been charged with 2 counts of manslaughter and 1 count of aggravated assault. Authorities say Officer Michael Hightower crashed into another vehicle back in October. 2 children were killed and another 2 remain hospitalized in critical condition. Court documents say that Hightower is to blame, saying that he was traveling at a high rate of speed without his lights or sirens. It's unclear if he was responding to a call or not, but he's been with the department for 2 years. In sports, the Rockets lost to the Denver Nuggets yesterday. It was a good game, 128-125. The final in that one went into overtime, but Houston was not able to come out on top. They play New Orleans in their next game. It's currently 49 degrees here on the UH campus, high of 63 today. I'm Matt Harab, News 88.7.
This is Houston Matters. I'm Michael Haggerty, filling in today for Craig Cohen. Good morning. Thanks for joining us on News 88.7 and on Houston Public Media's YouTube channel. Coming up this hour, the effects and consequences of issuing citations to Houston's homeless, plus the division of labor when it comes to preparing for holiday gatherings and festivities, and how to make sure no one person ends up bearing too much of the mental or physical load. And we visit an immersive multimedia holiday experience at ARTECHOUSE Houston. But first, a controversial new Medicare program is set to launch next month that'll use artificial intelligence to help decide whether patients should be approved for certain medical procedures. Now, Texas is one of 6 states that will be rolling this out, where this pilot program, it's called WISER. It will begin January 1st, and it's raising some concerns from physicians about delays in care and the role of profit-driven technology companies in medical decision-making. Meanwhile, as Americans faced yesterday's deadline to enroll in health insurance plans that take effect on the first of the year, millions are confronting some sticker shock. Enhanced subsidies that have helped make Affordable Care Act marketplace plans cheaper are set to expire here at the end of the year in just basically 2 weeks, leaving many facing premium increases of more than 100%. To help us understand what both of these stories mean for Texans and patients nationwide, we're joined by Dr. Vivian Ho, a health economist for Rice University and Baylor College of Medicine. Good as always to see you, Vivian.
Good to see you too, Michael.
Thanks for coming. This new Medicare program, it's called WISER, which is an acronym for Wasteful and Inappropriate Service Reduction. Texas, as I mentioned, is one of 6 states where this will launch January 1st. So what is this program and how does it work?
Well, essentially, before, there was no pre-authorization required when you wanted one of these fairly complex procedures, a lot having to do with issues of spinal injuries and things like that. They're fairly complex. And if you look at the guidelines, there are multiple different clinical guidelines that the patient is required to meet before those procedures are approved. And if they're not on the initial paperwork, then the procedure will be denied, and there's a process for appeal.
Okay. And so this, and these are pre-authorization, just means the insurance has to, the Medicare in this case has to say it's okay for these to be before they can be done, and it's just certain procedures then, not everything.
Yes, it's a limited number of procedures. I forget the exact number, maybe about a dozen. And if you look at them, they're complex procedures, not sort of the everyday type of thing that you and I would immediately see. Oh, I know that, a knee replacement or something like that. But they do look complex. They do look expensive. And so it's an effort by the Center for Medicaid and Medicare Services, CMS, to control the spending on these procedures.
So the program's going to use artificial intelligence to help make that prior authorization decision for procedures. I think it includes things like skin grafts, electrical nerve stimulators, knee arthroscopies. What usually happens when a doctor requests one of these procedures for a Medicare patient?
So currently for a Medicare patient, that just goes through. It is not like commercial insurance. There aren't all these different requirements, and so using AI potentially can improve that process because you have to go through so many different clinical criteria. And there are so many patients who need them. It's difficult, so you need computer assistants to be able to review the records.
The official line from the Centers for Medicare and Medicaid Services is that anytime there is a denial for one of these by AI, it will then be reviewed by a human clinician, and that the technology companies running this program will not be incentivized to deny claims. But the companies do get paid a share of the money saved, so how concerned should we be about that financial structure?
I think we should be concerned. You know, with CMS, we're going to see if they pay as much attention to implementation and enforcement of this program as they did to creating the acronym for it. And I am concerned that the software developers are going to get paid per denial. It seems, and that is just a terrible incentive. If you look and the problem is the waste usually occurs from a small number of doctors behaving badly, and most physicians don't. And so you want to catch those people, not penalize the entire physician workforce. And so there's ways you can do that. For example, in Texas, we have a law that issues physicians a gold card if they have very few denials on their, sort of things that have proven to be their practice has proven to be legitimate in the past. So we don't want to have all these prior authorization denials put on those patients. There's ways to restructure that penalty as well. And so if, for example, the company makes their money by denying everything automatically, there should be a financial penalty, and they should only get rewarded for those denials which are appropriate in the end. There's ways to do that. I hope that the government thinks it through carefully.
The many physicians groups, including the Texas Medical Association, have expressed some concerns about the program. What are doctors worried about?
Well, the doctors are worried about patients. Many of these patients are in pain, and the fact that their treatment could be held up by a significant period of time while you're going back and forth appealing, because in every case, you try and think of all the common needs for an operation, but there may be patients where the exception is legitimate, and if you just base everything on a simple AI algorithm, it's not going to be a help those patients.
It seems like this may put an increased burden on doctors if they've got to go back and document and send all this stuff in to get prior authorization. Is that correct?
Absolutely. It leads to higher costs for physicians. They're already bearing high costs for this in terms of appealing prior authorizations in the commercial sector. Some of that is legitimate, some of it is not, but it's frustrating when patients and physicians believe that it is an illegitimate reason to deny appropriate care.
Prior authorization, that practice has been already heavily criticized. In Medicare Advantage plans, there have been some lawsuits, investigations, claims that it delays and denies necessary care. Why is the federal government now expanding it to more broadly, traditionally, to Medicare overall?
Well, unfortunately, our healthcare costs are increasing, and including for the Medicare program, Medicare's costs have been rising less than the commercial sector, but nevertheless, they are rising, and we've got the baby boom retiring, more and more people qualifying for Medicare coverage. So as that patient group expands, we have to act proactively in any way we can to reduce waste.
What else, if anything, do you think the government should do or rethink when it comes to rolling this out, which they're planning to do here in just a couple of weeks?
Well, what I am concerned about is CMS is rolling out a lot of programs, but then they're not following up on what are the consequences. And maybe it's because they're spread too thin, that we don't have enough people working on these programs. But I do hope they listen carefully to what happens and what physicians complain about once the program starts. I think it maybe is a good step. A lot of thought was put into some of those criteria if you look at them, but I'm not a clinician. So I hope they go back and revisit carefully what's going on with the implementation. Make sure that the software developers are not sort of making off with a lot of our money just by denying care that's appropriate and necessary.
Let's zoom out a little bit for a broader view on healthcare. For many more Americans in general, many people are experiencing some extreme sticker shock lately if they're choosing a plan on the ACA marketplace. Without those subsidies that we're hearing, the average person will see their premiums more than double in some cases. Can you put that in perspective? I mean, how much are we talking about here, and who gets hit the hardest?
Well, it's going to be the self-insured and those who chose to retire early, those who cannot afford to buy coverage through their employer. There's apparently 4 million people who have ACA coverage in Texas, and there was a study put out by Texas A&M, I believe it was Laura Degg and Benjamin Newkirk, health economists there. They predicted in September, October that as many as, sort of somewhere around 800,000 Texans will not be able to afford ACA coverage because of the loss of the subsidies.
The deadline was yesterday for people to enroll for coverage in the ACA plans that would start January 1st, but there's still time for people to enroll to be covered in general in 2026, right?
Yes, there's still time. But what's kind of interesting is the reports in December that came out December 1 of early enrollment were ahead of the pace in the prior year. However, no one's had to pay a premium yet. So it may be that people are signing up and kind of saying, hoping for the best. Maybe the subsidies will come through, but it's then you want to see how many people actually send in the payment for the first month. We're not going to know that for a while.
Yeah, I was going to say, and again, that next deadline, the final deadline, January 15th, to be covered for the remainder of 2026. Yeah, and so what happens if all of a sudden those subsidies are restored, or some version of them are restored? Would it apply to people who've signed up here in these few weeks?
Yes, you would think so. If you want your best chances, you sign up, and then you just don't pay. There's no penalty for that, so take your chances.
Just lose your coverage, right? I mean,
right. Yeah.
So a lot of
if
people
you didn't sign up,
waiting it out to see what's going to happen. They want to be on the rolls if the subsidies are extended, and just see what happens, right?
Yes, absolutely.
Okay. I know Congress is still debating all of that. Do we feel like there's a good chance that some sort of subsidies might happen indeed?
Well, there's always the end of the year holiday miracles, but I think that's what we're left with. I think the House has put forward a proposal now. It's not great and doesn't include restoration of the subsidies.
It's a magical time. Miracles can happen, but we won't hold our breath necessarily. Knowing what we know about Congress, Dr. Vivian Ho is a health economist at Rice University and Baylor College of Medicine. Thanks, as always, for helping us understand all this.
Thanks, Michael.
Just ahead, can giving a citation to one of Houston's homeless end up keeping them out on the street longer? We'll discuss as Houston Matters continues on News 88.7 and on YouTube.
Hi, I'm Lenny Ambrose from St. Arnold Brewing Company, proud supporters of Houston Public Media. Right now, with your $60 donation, you can choose tickets to News and Brews. This member-exclusive event takes place February 17th. Enjoy a pint, connect with fellow NPR fans, and meet the Houston Public Media Newsroom in person. Select News and Brews tickets when you donate at houstonpublicmedia.org/donate.
To 1 p.m., taking a deep dive into the stories that matter to Houstonians, keeping you informed, engaged, and entertained. With the generous support from our founding sponsor, Kathy Sanders.
Support for Houston Public Media comes from the Museum of Fine Arts Houston, presenting Bayou Ben's Christmas Village. Santa and his reindeer have brought dazzling lights and a winter wonderland for families to enjoy. Tickets at mfah.org/Christmas Village.
Houston Public Media is licensed to the University of Houston system, governed by the UH Board of Regents. Information about open meetings, dates, times, and locations is online at uhsystem.edu.
This is Houston Matters. I'm Michael Haggerty, and today for Craig Cohen. Houston leaders continue to seek solutions for homelessness in the city. Back in mid-July, city officials expanded the so-called civility ordinance, effectively banning homeless people from sidewalks in certain parts of Houston. As Houston Public Media first reported, according to data from the city's municipal courts, law enforcement officers have since then ramped up enforcement of a separate citywide rule prohibiting more general sidewalk obstructions. But a growing debate focuses on one key question. Are citations helping or hurting? And are they, the folks who are looking for work and haven't had stable housing? Joining us to consider that question and others is Kelly Young, President and CEO of the Coalition for the Homeless of Houston-Harris County. Kelly, welcome to Houston Matters.
Thank you for inviting me.
And we welcome your questions or comments on this issue. Call or text 713-440-8870. You can email us at talk@houstonmatters.org, or you can comment on our live stream on Houston Public Media's YouTube channel. So for background, what are the circumstances the homeless can be given a citation in general?
So the ordinance downtown is about sleeping or having a certain amount of belongings blocking a sidewalk. And so you're not allowed to camp or sleep on the streets or block a section of the sidewalk at any point in time in downtown.
Okay. And then I guess people trying to understand so we already had that ordinance. What was the difference between that and the ordinance, the so-called civility ordinance that was just expanded?
That expanded it to overnight. So before it ended at 10, and now it just goes to overnight. So if somebody is blocking or sleeping on the street overnight, then they could receive a citation.
Okay. What is your organization's stance on those ordinances and how they're being policed?
Well, I think one thing we always want to remember is that the citation is not the first intervention, that the first intervention is outreach teams that run through the coalition or other organizations. And the idea behind that is that you're going out and reaching out to people and saying, hey, we've got services available or a place for you to stay. And if that person's willing to accept that, then they go engage in those services and move on with their life. In other situations, though, you have businesses or individuals in their community who call the police. And oftentimes police are the first to interact with individuals who are experiencing homelessness. And in that case, if they're in violation of the law or the ordinance, then law enforcement may use a citation as a way to encourage somebody to use services or to move on. And I know people don't really like to think of citations in that way, but all of us in different systems have tools that we use. And for law enforcement, they're getting a call from community saying, I want this person removed. They go out, they offer that person services, they try to engage them. That person does not want to engage or does not accept services. Then they offer a citation as a way to motivate in their minds to get the person to maybe take this more seriously and maybe make a different decision. Because the first thing they're going to do is say, hey, we've got a place for you to go and can we help you get there? Not immediately give them a citation.
That's what they're trained to first do that, I guess. Yeah.
Yeah. I mean, their goal, and most of the law enforcement that I've worked with, and this is not to say there aren't people that don't do this, but most law enforcement that I've worked with, their goal is to try to get that person somewhere safe and somewhere that they're not going to have to come back and revisit them. But we also know that there are cases where there's individuals who've returned to downtown or returned to a place that they're going to stay, and law enforcement's come out and said, you can't stay here, and they refuse service, and they refuse to go into housing, and they refuse shelter. And the law enforcement officer then is in a little bit of a quandary because they're getting calls from community, and they're getting calls to their supervisor saying, why are you not doing anything about this person? So I think it's one of those things that demonstrates the complexity of the work that we're trying to do, and that each of our systems that address homelessness have to have more tools that then benefit each other to help support that person, to help them move into a better system and not be on the street.
So things do escalate to the point of citation. What are some of the consequences that come with those citations, especially, even fines, especially if, say, more they stack up and go unpaid and that sort of thing?
So you can get multiple citations, and then if you don't show up at court, it becomes a warrant, which then puts a warrant out for you to be arrested. In most of those cases, again, a citation can be given. I mean, we have individuals who have citations, 200 citations, and they've got the fines that come with it. In most cases, as they go into court systems, they're not interested in trying to gain the fines from that individual because they know the individual doesn't have money. It's a pivot point to be able to say, look, we need for you to be able to get into services. So there's some diversion programs, in particular for low level crimes like trespassing and whatnot, to help try to get somebody into a service or into homes or into shelters. But yeah, I mean, if it goes for a long time or there's a stack of warrants, they may end up going into jail. The other side of it is that if we can get them into service and they get a case manager and they're assigned to a program, then they can go to homeless court and have all of that removed from their record. So there are mechanisms on the other side to ensure that that person isn't stuck with a whole stack up of fines they're never going to be able to pay, and a whole backlog of citations or warrants that really are not going to move them into a position that they really need to be in. So it's looking at one aspect of an entire process and saying, citations don't make sense. They absolutely don't, in the sense that if you were going to make everybody pay for them and if you were going to put everybody in jail because of them, but it's a diversion point that after getting the citation that they may have different options, and that's really where the focus and work really begins. So, for example, that's where maybe it's a veteran. Great, let's get the veteran services involved and hopefully get them housed or get them into services that they need there. If it's a mental health issue, great, hopefully mental health services can get involved. If it's a housing issue, maybe at that point that person will decide that they will accept housing. Because I think some of the things that people forget is that the individual has agency. And so if they don't want to talk to an outreach worker, or they don't want to accept help, they don't have to. And so I think from a law enforcement standpoint, their perspective is this might compel somebody into something, and then it becomes our responsibility on the other side of the system, so veteran services, mental health, homeless services, to really work our end of it to help that person realize that being on the street is not necessary and we really can help you. So it really puts the burden on us to do a better job so that law enforcement doesn't have to do their job.
So it's kind of about using it as leverage, knowing that no one's going to be paying $50,000 in fines, or most of us with jobs can't afford to pay those. So it's more about pushing them into the homeless court and other interventions.
Exactly. So I think one of the things that happens when you're looking at this from a systems perspective, each system has different tools that they use. Sometimes they work really well, sometimes they don't make sense. But when you stack them all together, hopefully what we do is for that person who is on the street and not able to decide that this is not a good thing for them, that by all of us working together and integrating all these different systems, that we might actually be able to help that person make a different decision at the end of it. And you need each one of those tools. And the truth of the matter is that most of the time, law enforcement is the first person who's going to engage. And most of the time, they're going to be the ones who engage over and over and over and over again. And a lot of the officers know these individuals and go out actively to see them and say, hey, are you ready? Is it time for you to go? Are you willing to do this? And so I think we want to make sure we put it in context of the whole way that we try to work with somebody who has the right to deny services. But we also have a community and groups that say, I also don't want them outside of my hotel or outside my restaurant or outside my house. So how do we balance all that the best we can? And I think it's important to put pressure on the homeless response system and the veteran system and mental health system to say, okay, we can do a better job as well to ensure that people get into our services and we help them stay in our services and connect to the types of interventions that they really need so we can reduce what law enforcement has to do.
You've said that a couple of times. We, as in the organizations like yours, can do a better job of helping them. What are some things you think you can do or need to be done to make that happen?
Well, a couple things, and I know that people get tired of hearing this, but funding is always very important. I think sometimes people think that the system is much larger than it is. We have about 35 individuals that do outreach across Harris County, City of Houston. City of Houston and Harris County have put in every dollar that they can find into homelessness, but that is typically federal funding. So when there's changes on a federal level of funding, people need to realize that that's the only dollars that are really addressing homelessness in Houston and Harris County. So funding that, I think recognizing too, how do you get involved with organizations to help them support not only their outreach efforts, but their services in general. So if you're doing feeding groups, that you're paying attention to the fact that if you're going out and feeding individuals, that you have a responsibility to go and clean up that neighborhood after you've done that feeding, because that neighborhood, you're basically saying that the individual who received the food is now responsible for cleaning up the neighborhood, and they're not able to do that, but you are. So just ensuring that you're engaging in your community and the support in a way that's actually helpful to the agencies, to the community, and really is helpful to the individual you're trying to help.
You mentioned as well the homeless court. What happens when someone is diverted into that? What all goes on?
Well, what's great is we actually have a representative from Coalition for the Homeless that goes, case manager makes the referral. If the person's engaged in services, they go and they basically, it's like a graduation. They basically have a judge who says, great, you're meeting all these requirements, and we're just removing all of your citations, and we move on. In some cases, they may say, you owe for these certain things, and the person's working now, and they want to pay because they want to give back. But the whole idea of it is to help people get a fresh start and an opportunity for them to own that they've moved on in their life. And so it can be a really empowering moment to stand there and be like, that's what I used to have happen, and I really engaged in taking care of myself and moving myself on. I've got these services, and I'm going to go ahead and take care of and be the person I want to be in the world. And so it's actually a very encouraging environment, and we are very unique in having a homeless court as we do. We'd like to see expand into Harris County, and I think we will get that.
This is Houston Matters. I'm Michael Haggerty, filling in today for Craig Cohen. We're talking about the effects and consequences of issuing citations to Houston's homeless and just the homeless situation in general here in Greater Houston with Kelly Young of the Coalition for the Homeless for Houston, Harris County. And we welcome your questions and comments at 713-440-8870. You can call or text that number or talk at houstonmatters.org. So, let's zoom out a little bit here. How would you characterize the homeless situation in Houston in general right now?
Well, we know that we have a couple issues around inflow. So we are working on a couple strategies around respite care for people coming out of hospitals. So individuals who are homeless before going into hospital care or psychiatric units, being able to have a respite model on the outside of that so that they are securely housed and taken care of for a period of time so they really can recover. And then we do need to look at a reentry system to make sure that individuals leaving our criminal justice system are set up for the best possibility of success. The second thing is ensuring that we create job programs and training programs that really work for individuals who are exiting homelessness. They tend to need a little more supports and things in place to be able to be successful, but then they can move on and be able to be earning the incomes that they want to be able to manage their lives. I think we have done an incredible job over the last 12 years. We've housed, we've reduced homelessness by 60% in Houston, but we're seeing a change on a federal level in terms of the type of funding that we're going to get and the type of services we're going to do. Coalition is always prepared to be able to make those adjustments. We're more interested in innovation than philosophy, but we're going to see a change in our community, and so we need to be prepared for that. One of the great things that we've worked on with the city and county is building out stronger relationships with the mental health system, with law enforcement, looking at the unincorporated or the rural areas of the county to really determine what type of services are necessary. So we've housed a lot of individuals who had documented disability and probably need long-term housing interventions, but we have a large population that won't meet those requirements but needs something sort of intermediate. So some type of rapid response. It may be that they're actually trying to get back to Kansas because that's where their family is. So how can we help support that? Or they need 3 months worth of rent and utilities because their job, they got cut, a couple of their shifts at work. And so they're trying to find another job, but they need a little bit of support in between. And so we're starting to work more upstream as well as ensuring that those that need long-term housing have that available to them.
Can you give me an example or two of just how the changing of how things are going, the approach from the federal level is changing what you're able to do here?
So the two major changes is that they reduce the amount of what's called permanent supportive housing to a cap of 30%. And so that means that out of all the dollars that come in from the federal government, only 30% of that can be spent on permanent supportive housing. Our portfolio is about 90%, so we have to figure out what to do with the changes in those dollars. What they've done, though, is then added transitional housing. So building out programs that are 2 years' worth of housing with additional supports for substance use, mental health, and employment. It is a model that has been used before we actually went into Housing First and permanent supportive housing modeling. The best solution is a mix, and that's one of the things I really hope we learn out of the next couple of years is that it's really not a philosophical issue, it's a mathematical issue. When you use data to determine what types of intervention people need, how much money it costs, how many people need that, and you build out a model based on that, we will continue to make the kind of dents and work with the type of people we need to serve in a much better sense than just saying it's all or nothing or it's this way or that way. So what I hope we will learn in the next couple of years is what is the right level and different types of intervention that works best for Houston and Harris County.
In between what the city of Houston and your organization are working on, I mean, what are some of the things coming up to address homelessness in Houston that you're looking forward to that are in the works?
I think one of the things we've always struggled with is really easy identified front doors. Most people I talk to are like, I don't even know what to do if I see somebody who's homeless. And so the city has a particular project they've been working on with 419 Emancipation, which will create a much more visible front door that really will be around triage and transition, which will help people be able to move into the right systems much more quickly because you will be able to say, oh, we need to take somebody here versus saying, I don't know what to do and just call the police. So I think from the city's perspective, that's a really helpful piece that they've added to the overall continuum of care. I think on the county side, it's really trying to pinpoint areas outside of the city that we see homelessness. We also see nuisance abatement, different aspects, sort of hot spots, and can we coordinate services around that so that we're actually tackling multiple issues in a particular area that is in the outside areas of Harris County, which have not typically been done and have not been coordinated in that way. So these are, again, using more of a data-driven, pragmatic approach to it and not sort of, oh, this person's experiencing homelessness, we have to do something about them. And then we need to go over here, we need to go over here. It's more like, no, let's sit out, map this out, figure out what we have, use our resources appropriately, and then build out the right interventions.
Kelly Young is the president and CEO of the Coalition for the Homeless for Houston, Harris County. Kelly, thank you so much for talking with us.
Yes, thank you for having me.
Just ahead, how to make sure no one person in a family ends up carrying more than their fair share of the load, preparing for holiday gatherings and festivities. Stay with us as Houston Matters continues on News 88.7 and on video at HoustonPublicMedia.org and on YouTube.
You count on Houston Public Media. That's why you're here right now. Take the next step and become a new member today. Every gift makes a difference. And with a gift of $5 a month or more, you'll receive PBS Passport, a member benefit that lets you stream more of the shows you love anytime. It only takes a minute to make a big difference. Join as a new member today at HoustonPublicMedia.org/donate or call 800-364-8300.
Reporting strong in Houston.
Support comes from the Dan L. Duncan Comprehensive Cancer Center at Baylor St. Luke's Medical Center, offering comprehensive cancer care that is compassionate, personalized, and driven by clinical research. More at stlukeshealth.org/cancer.
Houston Matters with Craig Cohen is made possible in part by Ellen Benninghoven and Dr. Michael Schaefer, and gifts from listeners like you.
This is Houston Matters. I'm Michael Haggerty. Maybe you've seen this play out during the holidays. The living and dining room is filled with laughter and old favorite movies or football games and a warm, cozy party with loved ones, while meanwhile in the kitchen someone is stressed and overworked from cooking, cleaning, and hosting to make all of this possible. As families gear up for holiday gatherings, the workload of cooking, cleaning, and coordinating can sometimes fall unevenly. So now we're going to explore how couples and families can talk openly about what feels equitable, set realistic expectations, and decide which traditions to prioritize or pause for a calmer, more balanced holiday season. Here to discuss all that is Robyn Martin, senior clinician from the Menninger Clinic. Robyn, welcome to Houston Matters.
Thank you, Michael. Thank you for having me.
Yeah, glad to have you. And we welcome any questions or comments you might have. Who does what in your family, and how is that maybe different than what you grew up, or how do you try to spread the workload? You can email us, talk@houstonmatters.org, or you can call or text 713-440-8870. You can also comment on our live stream on Houston Public Media's YouTube channel. So let's get this out there first thing. For a long time, so much of making things possible for the holidays fell on women. That might still be the case. Some families, mothers, grandmothers, in traditional gender roles, food, presents, decor, all that. How much of that is still the case?
I would say a lot is probably still the case. I think it's all about communication, though. If you are feeling like you are a one-man show, it is important to kind of communicate that, to figure out what all you prioritize and want to do with your holiday season, and to really kind of have a team meeting. I think where a lot of things can go wrong is someone gets burnt out and they come at it from a place of frustration instead of a place of collaboration. So having those talks and having an approach that's collaborative is of the utmost importance, because that's the only way to really start to band together, as opposed to like having defensiveness kind of come out. So getting an idea of early on in the holidays, so probably beginning of November in a perfect world, of what all you want the next 2 months to look like and kind of who can handle what. That is generally the best practice.
Yeah, I mean, how do we typically go about divvying up the workload? I mean, sometimes it can be, tradition, like, okay, so-and-so always makes this. I think my mother-in-law always makes the fudge because she's good at it, or whatever. However we decided that. I mean, how does it all get divided up usually?
Yeah, I think in a perfect world, it's going to be who has those gifts and talents. In my house, I am not the cook. My husband actually is. I am not a good cook. And so he naturally fills that role while I kind of fill being other parts of our holiday as far as wrapping presents and making sure everything else is taken care of. So I think it comes down to impart skill and communicating who wants to do what. I think kind of speaking to what you said, it sounds like sometimes people fall into roles that they might not like or they might grow out of. And it's important to communicate when you feel like your role doesn't fit your skills or your interests anymore.
Yeah, that reminds me of a dangerous phrase of like, that's just how we've always done blank, right? That can get us into trouble if, maybe my mother-in-law loves making the fudge and that's not a problem. But if it is a burden because she's got to also do all these other things or whatever, then there's, then it's, I guess the impetus is on someone to communicate if, hey, like I might need some help, or I don't want to do this anymore. I can't do this.
Yeah, we're not mind readers.
Yeah.
No one has that special talent. So it is important to communicate when you feel like you've moved on for something, or every year can kind of present a different struggle. So to know where you're at based on the year you've been having, or what your months look like or your days look like, it's important to kind of say, hey, I don't have the energy for this, or I don't have the time or the space for this. And I think that's where a lot of people go wrong, is they strive for perfection instead of being present. And so sometimes that strive for perfection can leave people to feeling really burnt out, as opposed to really what the holiday is about, is being present. And so kind of recognizing what are ways that we're getting in the way of presenting how we want to be during the holiday season.
This is Houston Matters. I'm Michael Haggerty. We're discussing the division of labor during the holidays to make sure no one person in a family ends up carrying too much of the mental and physical load of making sure gatherings and festivities go well. Who does what in your family, and how is that maybe different than what you grew up with? We welcome your questions and comments at 713-440-8870 or talk@houstonmatters.org. My guest is Robyn Martin of the Menninger Clinic. You alluded to this about, your husband does some of the cooking or does a lot of the cooking. It does seem like maybe there are some differences now, more people doing things outside of the traditional gender roles based on, hey, who's good at it, who likes doing it, that sort of thing.
Yeah, I think we get to write our current families. I think sometimes we get into trouble when we just do what we were taught to do as opposed to what feels congruent to who we are and what we value. In my scenario, my husband loves to cook and he's really good at it. And if we kept gender roles, people would be eating a lot of burnt food from me.
Wouldn't last long,
so
maybe,
it's
yeah.
safer for all to lean in.
Yeah, that problem may fix itself after a little while. Yeah, and you alluded to this as well, but what advice would you give people for rethinking and assessing, okay, should I continue doing this tradition or maybe not going to this gathering or making this complicated dish or whatever it is that we've always done because I'm worn out, I'm stressed out, it's not bringing me a lot of joy and causing more trouble than it's bringing joy in this busy season.
Absolutely. I think the first thing to do is to sit down and think about what do you value? When you think of the holidays, what stands out to you as the most important thing? And that can be different for a lot of different people. And I think we all have this expectation to make it the most wonderful time of the year, the most exciting time of the year, or things like that. And the reality is that having a busy schedule does not necessarily mean you're having a full life or a full experience. I think our society has kind of gotten to the point of busyness and being full or being fulfilled are kind of synonymous when that's really not the case. We know that when people are in a hurry, they're not present. And when you're not present, you're not really enjoying things.
Yeah.
So then things start to feel like work.
What advice would you give for helping a loved one who's maybe not as comfortable communicating their feelings and feels like, maybe they're from a different generation than you are and sort of won't want to ask for help or have to do this thing. They're not going to be as open to maybe shaking things up or asking for help.
Yeah, I think that is a tricky situation. I think part of it is knowing our family members and knowing what they utmost value. Hopefully you kind of have an idea of why is this important to them? Is this important because a family legacy is important and they feel like this dish is part of the family legacy? Or do they do this because it's their way of showing love and they really want to make sure that everyone knows that they're loved? And so sometimes when we look at like what the motivator is, it helps us know how to respond or add assistance or kind of intervene when we need to, right? Because I think sometimes people get really into making these dishes or to having these experiences, and it's their way of trying to connect, but at some point it starts working against them. And so I think for people that struggle to ask for help, being open to hearing it or kind of modeling it ourselves is one step, but the other step is to be curious and to look at the motivator. What is motivating this person to really kind of stick with this behavior that's not working or this tradition that has started to take more effort than it's worth? That's truly kind of the most helpful guide is what are they trying to get from this? Because it's not about the ham at dinner or the mashed potatoes. It's about creating a sense of nostalgia. It's about creating a sense of connection. It's about creating tradition. And so sometimes it's being curious about like, does this actually add to that? And being willing to make changes where changes are needed.
Yeah. As my wife always says, no one will remember all those details if the mashed potatoes weren't just right, but they'll remember if they had fun and they had a good time. Robyn Martin is a senior clinician from the Menninger Clinic. Robyn, have a happy holidays and stay out of the kitchen.
Yeah, thank you, Michael. I will.
You're welcome. Still to come, we visit an immersive multimedia holiday experience at ARTECHOUSE Houston. Stay with us as Houston Matters continues on News 88.7 and YouTube.
It's not just your car. It's the one that brought your kids home from school, took you cross-country, held memories, laughter, even a few breakdowns. When it's time to let go, give your car a new purpose. Donate it and turn memories into meaningful support for this station. Plus, you'll enjoy free and easy pickup, potential tax benefits, and a simple donation process. Your gift supports the programs you and your family love. Donate today and help keep public media strong. Call or donate online.
And Beverly McPhail, supporting media that's free from commercial influence and grounded in journalistic integrity, because trust in news matters, now more than ever.
Support for Houston Public Media comes from Baylor College of Medicine. With 125 years of innovation behind it, Baylor has driven progress in health and medicine through research, education, and care that push the frontiers of modern science.
While much of the holiday season is about tradition, you might be in the mood for a little something different from some of the typical experience and offerings this time of year. So for a Christmas experience that's a little more steeped in the 21st century, ARTECHOUSE Houston is running Spectacular Factory, the holiday multiverse, which is full of computer-generated displays celebrating the season, including a number of elements visitors can directly interact with. Houston Matters producer Joshua Zinn visited the space to see and hear what it's all about.
The journey begins looking at the ceiling as a montage of Christmas-themed imagery appears to descend from above on a broad circular screen. Large cushions are provided for viewers to lie back and take in the swirling peppermint background as a rush of snowflakes, toys, and wrapped gifts fly past.
So this is a ceiling projection from the rear, and we're seeing something that is sort of inspired by going through a chimney. So you'll see in the beginning and the end of the content, little Santa going by to give you a little sense of where the inspiration came by. And this is just to get you sort of into the mood to go into immersive content. You'll see that there's like a through line of the colors and the content and how the doors and going into a multiverse type of thing, yeah.
That's Ricky Kim, the Executive Creative Director for ARTECHOUSE. Jonathan Beitler is Director of Marketing and Revenue, who explains that one of the major draws of ARTECHOUSE is the way it includes its viewers in the exhibits.
We really have developed an incredible immersive space. People can participate in the art and really see something different and new and unique and that's cutting edge in the art world, yeah.
Leaving behind the descent through the chimney, the next display is within a space completely surrounded by mirrors on the walls and ceiling, with a video on the floor featuring what else but flamingos skiing down a seemingly endless snowy slope.
This is by actually a digital artist named Gavin Shapiro. He's actually well known in the digital sphere for his sarcastic and fun looping videos in the social media world. And we have his work in New York City, and he has this incredibly fun piece that is a little bit absurd, but that's a fun piece of it. And one of his iconic characters are these dancing flamingos. So this is a loop that he did, and it's just fun little flamingos.
Scattered throughout the exhibit are a number of animated interactable screens. One features a wall of keyboard tiles that change colors according to what's in front of them. Another has a hydraulic press squishing a pile of blocks. And there's one with a bunch of Christmas presents almost moving like a Rubik's Cube.
All around this gallery are these interactive screens, and we keep them up year-round. They change for their exhibitions, but they're really a way to kind of allow people to interact with art in really weird and different ways. So each of these are part of a series called Oddly Satisfying that is kind of a departure from your traditional holiday themes that you think of, but making it very ASMR. So it's kind of giving you this calming, soothing effect that I really like because most of the time you're just, thrust in front of just all sorts of crazy holiday stuff, and it's just like bells and whistles everywhere. This is a little more like tactile and kind of gives you those chills, like the good feelings.
There's even a little jukebox where songs come out of presents that are selected by a flying drone. And to really lean into the very contemporary 21st century aesthetic, you can also talk to an AI avatar named Sora.
But yeah, that's Sora. Okay. It was part of one of our most popular exhibits in DC in spring, and we made her into a holiday version. Okay. And the idea is that she's from a parallel world, and this is it's a telecommunication, like it's a hologram. And she was specifically from this world called Neo City, and she was one of the popular ones. So we trained her script to be contextually in the holiday sort of world. So you can have a conversation with her.
Hello, Sora.
Hello. How can I assist you today? Curious about Neo City or anything else?
Yes, tell me about Neo City.
Neo City, or Neo Tokyo, is a place where technology and humanity blend seamlessly. Known for AI, robotics, and innovative festivals like Cycle's End, it's a city of creativity and connection. Anything specific you'd like to know?
How do you feel about the advancement of artificial intelligence?
I'm excited about AI's potential. In Neo City, we focus on empathy and connection, using AI for good. It can enhance lives, foster understanding, and bring people together. Collaboration is key. How do you view AI's role?
Oh, she's asking me questions. Interesting. Let's just say that's a conversation for another day. But on to the centerpiece of the ARTECHOUSE Holiday Special, a huge open space where you find yourself surrounded by a video projection that takes you inside Santa's workshop. This kaleidoscope of images consists of gifts running along conveyor belts, dancing nutcrackers, and even a cozy Christmas village.
So this is called, this is a namesake of the exhibit, so it's Spectacular Factory. And the concept was that we start so if you go in, the beginning of the loop starts in a factory. And the ideas were started from, okay, where does all of the presents start?
Santa's workshop, basically.
Yeah, so it's like Spectacular Factory, and each of the scenes are actually like inside a gift.
Oh, okay,
Yeah.
cool.
So that's why you're going
So
inside.
we're surrounded by tinsel and wrapping
Correct,
paper right now, and ribbons and bows. Okay, I dig that.
Yeah, so we're in the tinsel world. This is one of the gift boxes, and the next you'll have candy canes and as a merry-go-round.
Yeah.
And the other one, there was a multiverse of the little village world. We also have a time limit, right, and a resource limit. So we have to make really interesting content with limited resources. And one of the ways that we did that was okay, we have this multiverse, let's create this multiverse inspired by Inception.
Yeah, it does feel very Inception, yeah.
Yeah, and so that's inside one of the gift boxes. The other one, you'll see that it's Nutcracker. So it's, basically you're going through a gift box after gift box to the gift box. Yeah.
All right, very cool.
And then you end back up in the Spectacular Factory.
Yeah. And it all kind of loops seamlessly, right?
Correct.
You can't really tell where the beginning or the end is.
Yeah, and that's how most of our content is designed for programming reasons, and so people don't feel like they miss out on something, and they feel like, they want to see it again and again and again. Yeah.
Okay. So if you're just itching for a holiday event that won't have you out in the cold at night, ARTECHOUSE Houston has some things that you might have not really seen before.
We are kind of a departure from your traditional holiday light show. We are the future of holiday light shows. We really provide an opportunity for people to see something different that they might have never seen before, to be fully immersed in this holiday spirit. And it's a perfect place to bring the whole family, because there's something for everyone here. We have the classic holiday imagery. We have the candy canes and the reindeer and the skiing flamingos, but we also have this ASMR element too that kind of gives you that calming feeling when so much of everyone's lives are stressful during the holidays. Come here and you can really find some enjoyment in the art that's displayed here. And it's all original art, and it's all designed to really showcase this new type of emerging technology.
For Houston Matters, I'm Joshua Zinn.
And Joshua talked with Jonathan Beitler and Ricky Kim of ARTECHOUSE Houston. Spectacular factory, the holiday multiverse is on display now. And that does it for this hour of Houston Matters. Make sure to tune in tomorrow. We'll get some clarity and insight on the latest developments in politics in our weekly roundup. Also, as DEI programs roll back nationwide, we learn how one Houston leader is doubling down on inclusion, starting with kids. And singer Sarah Brightman, star of musical theater, classical music, and many a PBS Pledge special, will talk about her upcoming holiday show in Sugar Land. I'm Michael Haggerty. Craig will be back tomorrow. Join us then for those and other Houston Matters.
Your support this season shapes the stories we'll tell tomorrow, from local news to weather